The sun rises over Gaza, but hope remains dim. The World Health Organization says the situation in the enclave is nothing short of catastrophic, a word repeated again and again by those who have seen the destruction up close. From the shattered hospitals of Khan Yunis to the overcrowded shelters of Deir el-Balah, the health system that once served over 2 million people is now on the brink of total collapse. Only 14 of the 36 medical centers in Gaza are still functioning. Even those are overwhelmed, with little electricity, minimal equipment, and doctors working double shifts with barely any rest. In Geneva, the tone was somber as the head of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, addressed reporters. He warned that without an immediate and massive influx of aid, Gaza's humanitarian crisis will deepen beyond imagination. If the aid entering Gaza is significantly low, it will not reduce the level of hunger. And the situation remains catastrophic because what is coming in is not enough, said Tedros, his voice steady but edged with frustration. The WHO estimates that rebuilding Gaza's shattered health system will cost at least $7 billion, the equivalent of almost 38 billion reais. That figure represents not just the reconstruction of hospitals, but also the replacement of critical medical infrastructure destroyed by months of bombardment, from ambulances and incubators to dialysis machines and surgical units. Inside Gaza, the images speak louder than numbers. Ambulances pull up to the gates of Al-Aqsa Hospital in Deir el-Balah, medics rushing out to carry the wounded. The corridors are filled with the echo of crying families and the scent of antiseptic. In one corner, a man weeps as he lifts his sister's lifeless body. In another, hospital staff gently wrap white sheets around the dead. The United Nations and humanitarian agencies continue to appeal for unimpeded access, yet the border crossings remain tightly controlled. Aid convoys line up outside Rafah and Kerem Shalom, waiting for permission to enter. Each day's delay costs lives. In Jerusalem, the political rhetoric grows harsher. Israel's Foreign Minister, Gideon Saar, dismissed recent rulings by the International Court of Justice, calling them biased and politically motivated. The International Court of Justice had ruled that Israel must facilitate the passage of humanitarian aid into Gaza and refrain from using starvation as a method of warfare. Inside the Grand Hall of the ICJ in The Hague, Judge Yuji Iwasawa, the court's president, read the decision aloud. The court calls upon Israel's obligation not to use the starvation of the civilian population as a method of warfare. But back in Jerusalem, Saar rejected the legitimacy of the ruling outright. "This is not a court of justice," he said. "It is a sham court, a corrupt political circus. It has been weaponized by Israel's enemies. It is being used to try to force Israel to accept measures that would jeopardize our security." His statement drew strong reactions from diplomats and legal observers worldwide, who warned that undermining the authority of international institutions could set a dangerous precedent. At the same time, the ICJ addressed one of Israel's key claims, that members of the United Nations Relief and Works Agency, or UNRWA, had taken part in the October 7th attacks. Judge Iwasawa clarified that the OIOS investigation in 2024 led to the dismissal of 9 UNRWA staff members due to their possible involvement in the 7th of October 2023 Hamas-led attacks against Israel. But he stressed that this evidence is unable to support a conclusion that UNRWA as a whole is not a neutral organization. This distinction is significant. It reaffirms the role of UNRWA as the main provider of basic services in Gaza: food distribution, education, and emergency shelter. The agency's work, already hampered by funding cuts and political pressure, is now more crucial than ever. Meanwhile, Foreign Minister Saar sharpened his language further, turning his criticism toward Hamas. Hamas and Islamic Jihad must lay down their arms. Gaza must be demilitarized. It must no longer be allowed to pose a threat to Israel and its citizens. This is at the heart of the Trump plan. We will not compromise on it. His reference to the so-called Trump plan, a US-backed framework that conditions reconstruction and political dialogue on the complete disarmament of Palestinian factions, underscores Israel's continuing security doctrine. Saar added that Hamas is deliberately delaying the process of handing over the remains of 13 Israeli hostages believed to be dead. Hamas must uphold the agreement, he said. We know it can easily return most of the remaining 13 dead hostages. It is slowly trickling the return in order to delay the second phase of laying down its arms. Inside Gaza, however, such political exchanges feel distant. The people's concerns are immediate: clean water, food, medicine, and the hope that tomorrow will not bring another airstrike. Humanitarian workers describe entire neighborhoods turned to rubble. Hospitals once buzzing with life are now skeletal structures. Generators roar through the night to keep a handful of operating rooms lit. At Al-Shifa and Nasser hospitals, doctors work without pay, improvising surgical procedures with dwindling supplies. A pediatric nurse describes sterilizing instruments over candle flames. Across the Strip, infectious diseases spread fast among displaced families crammed into temporary shelters. The World Health Organization says the lack of clean water has triggered outbreaks of diarrhea and hepatitis. Wastewater treatment plants have stopped functioning. Mosquito-borne diseases long under control are now returning. The combined impact is what Tedros called a collapse of public health capacity. In Geneva, aid coordinators warn that rebuilding will take years. The $7 billion reconstruction cost includes not only the physical structures, but also the training of medical personnel, hundreds of whom have been killed or injured since the fighting began. WHO officials emphasize that without sustained international commitment, even the most advanced hospital design will remain just that, a design on paper. International donors face a dilemma. Many governments are reluctant to fund large-scale reconstruction unless there is a durable ceasefire and credible political framework in place. Yet without immediate investment, the humanitarian toll will continue to rise. In Washington and Brussels, policymakers debate how to channel funds without indirectly empowering militant groups. The Biden administration, along with European allies, has pledged to coordinate reconstruction through international agencies. But analysts warn that aid corridors alone will not solve a fundamentally political crisis. In Israel, public opinion is deeply divided. Some support the government's hardline stance, insisting that Hamas must first disarm. Others fear that continued restrictions will prolong suffering and alienate global allies. On the streets of Tel Aviv, demonstrators gather with banners reading, "Let aid through and bring them home." Families of hostages speak to the press, torn between grief and anger. One father says he just wants his son's body returned so that the family can finally bury him. In Gaza City, families mourn in silence. The call to prayer echoes over broken buildings. Mothers line up for scarce bags of flour, while children fill jerry cans at a leaking pipe. A local doctor says he has learned to diagnose infections without lab tests because there are no labs left. For those who survive, mental trauma is becoming the next invisible epidemic. Psychologists estimate that nearly every child in Gaza has experienced severe psychological distress. Many have lost siblings, parents, or entire homes. Back at WHO headquarters, the agency's emergency director outlines a grim equation. Every week without adequate medical aid means another 1,000 preventable deaths. Hospitals lack anesthesia, antibiotics, and even clean gauze. Pregnant women face life-threatening complications because obstetric units have no incubators or surgical tools. The organization calls for an immediate humanitarian ceasefire and full access to all areas of Gaza. Tedros stresses that rebuilding is not only about concrete and steel, it is about restoring human dignity and the right to health. But the challenge is daunting. Reconstruction would require rebuilding dozens of health facilities, restoring the electrical grid, importing specialized equipment and ensuring long-term maintenance, all under strict border controls. Even if funding was secured today, experts estimate it would take at least 5 years before Gaza's health system could function at pre-war capacity. At the International Court in The Hague, proceedings continue. Legal teams from both Israel and Palestine submit evidence and counterclaims. The judges' panel reviews satellite imagery, casualty reports, and expert testimonies. Behind the legal language lies a deeper struggle over accountability. Who bears responsibility for the suffering of civilians? For Israel, the narrative centers on security and self-defense. For the Palestinians, it is one of occupation and deprivation. Between these competing narratives stand international institutions trying to uphold the principles of humanitarian law. In the closing moments of the ICJ session, Judge Iwasawa repeated what has become a defining principle. No state can justify starvation or collective punishment under the laws of war. It was a line that resonated across diplomatic corridors and humanitarian circles alike. In Jerusalem, however, Minister Saar remained defiant. He signed new bilateral agreements with Albania and vowed to continue Israel's military and diplomatic campaigns. His aides later told reporters that Israel will never allow any court to dictate its security policy. As the political debate continues, the people of Gaza count the days by the arrival of aid trucks. Each convoy that crosses the border is a small victory, a chance for food, for fuel, for medicine. But the need far exceeds what is delivered. Satellite images show neighbourhoods flattened, roads blocked, and hospitals reduced to rubble. Drones capture the slow movement of displaced families walking westward, toward the coast, toward uncertainty. At dusk, the sky turns orange over the ruins of Khan Yunis. Smoke drifts above the city as the call to prayer fades. A doctor in a field hospital sums it up in one sentence: "We don't need speeches, we need supplies." Back in Geneva, WHO officials finalised their latest situation report. It lists the same words repeated across every page: catastrophic conditions, critical shortages, insufficient aid. Dr. Tedros closes the briefing with a reminder: health is not a privilege. It is a human right, even in Gaza.